Hello, my name's Sophie Collinson, and this is my academic poster on the National Health Service, 1948 to the present day. Firstly, the poster covers the background on how the NHS emerged. During the Second World War, Sir Winston Churchill, who represented Conservatives, and Clement Attlee, representing Labour, joined forces and recognised the need for post-war reconstruction of healthcare needs. Sir William Beveridge produced the Beveridge Report in 1942, identifying five giants: want, disease, ignorance, squalor, and idleness, highlighting the need for the reconstruction of healthcare system. Churchill was unsure of post-war economic structure but advocated a national compulsory insurance for all classes for all purposes from the cradle to the grave. The NHS was established and launched in the United Kingdom on the 5th of July 1948. This historic moment making British history was a culmination of a bold and pioneering plan to make healthcare no longer exclusive to those who could afford it, but to make it accessible to everybody. The NHS was born. Britain was the first westernised country to offer free medical care to the population. The government of the day and the Prime Minister at the time, Clement Attlee, introduced the NHS, changing the delivery of care into a new, improved form that was accessible by all. So the poster moves then on to the purpose of the NHS. So the purpose of the NHS was to provide everyone in the United Kingdom with healthcare based on their needs and not on their ability to pay. And this still is the same today. The NHS strives to improve healthcare, well-being and people's experiences. Everyone counts by maximising their resources for the benefit of all the community, ensuring no one is excluded or discriminated against or left behind. The NHS has 6 values. All staff are expected to demonstrate these: working together for patients, respect and dignity, commitment to quality of care, compassion, improve lives, and finally, and importantly, everyone counts. The poster then goes on to social factors. The social determinants of health are economic and social conditions, circumstances that influence individuals and groups differently in health statuses, such as where they live, environment, genetics, income, education, and more. The health promoting factors found that one's living and working conditions rather than individual risk factors that influence the risk of vulnerability for disease or injury. The discrimination of social determinations is often shaped by public policies that reflect privileged political ideas of the idea. Social factors could include income and social protection, education, unemployment and jobs insecurity, working life conditions, food insecurity, houses, basic amenities and the environment, early childhood development, social inclusion and non-discrimination, structural conflict, access to affordable healthcare of decent quality. So next on the poster is the political factors. These could include funding, access to services, housing, cost of living and food access, ageing population, high patient expectation, mixing political and managerial control, legal factors and litigation. In 1948, there was funding, so all areas of care and services were covered by the introduction of the National Insurance Act 1911. Funding now is being reduced and cut, affecting the delivery of service. Funding is overseen by the government and which political party is in control at the time. Some are wishing to cut back and or privatise areas of healthcare. However, other parties invest and promise monies to services within the NHS. These cutbacks that are due to political decisions may affect access to care. Housing and living costs can also indirectly impact these areas. The ageing population. It is common knowledge that people are living longer due to new and expanding interventions shown in the chart. This is a good thing but has financial impacts due to the need of costly treatment management such as diabetes and various cancers that can occur because of aging. Advances in social media increase knowledge of people and gives them higher expectations of treatment they are entitled to, so expectations of the NHS are higher than ever. Mixing political and management controls are creating confusion and reducing transparency in decision making regarding the running and delivery of care. Legal factors such as litigation. This is where people have received unsatisfactory, poor quality, poor delivery, and or poor outcomes of care resulting in individuals seeking compensation in court. Policies and guidelines are generated by the NHS management and directors. However, politicians do influence these by sitting on committees and meetings on a community, national and global level. Ideological factors established in World War II, representing an idealistic institution of delivery of care, comprehensive healthcare service for all, regardless of wealth. Significant changes in the NHS is next on the poster. New structures and responsibilities across the NHS introduced by the Healthcare Act of 2022 means that the NHS England has taken on new responsibilities in supporting integrated broad boards and NHS providers and hold them accountable for their delivery of service. NHS Act of 2006 was created to take in the view of patients and the public. NHS England is to account for process in taking forward the mandate, which was intended to apply from the 15th of June 2023 until a new mandate is published. NHS England has a duty to seek to achieve the objectives in the mandate, such as cutting waiting lists, improving outcomes for cancer patients and getting an early diagnosis, building a right for choice, giving patients more information, improving A&E and ambulance performances, improving GP access, investing in IT and equipment to deliver treatment, creating apps and increase collaborative workings across the services, improve income and outcomes by making on the long-term plan to transform services and improve outcomes, retaining staff training and retention of recruitment, apprenticeships, promotions, good rate of pay and working conditions, as they say in the NHS, grow your own. Funding. It is essential that public money for the NHS continues to be spent with care. which includes ensuring that financial risks to the overall health and care system is robustly managed and that any financial interventions, especially regarding the delivery of key objectives, are targeted, timely and measurably. The graph statistics show the impact of the new adjustment model on providing level scores on services. To access the difference between the new and the existing models since analysing the composition of the 276 provided level score. This is for primary hip replacements in 2010 to 2011. It has plotted providers' average adjusted health gain scores calculated by the current method against the score calculated by the new proposed method. The graph shows that the scores are very similar, with the biggest difference in the score being plus/minus 2.47238 on a scale of 0 to 48. Hip surgery has increased due to social and ideological. And lastly, on my poster is the impacts of change. In the 21st century, life expectancy has risen significantly due to factors such as universal health care, medical advancements in treating disease like heart disease and cancers, healthier lifestyles influences on lifestyle changes such as less smokers, healthy eating and exercise advance and intervention. Vaccination strategies, more people are having vaccinations against known diseases from infancy and child immunization schemes. Thank you for viewing my post with me.